What is the risk of infection after DBS battery replacement surgery? Have you ever wondered about the risk of infection after deep brain stimulation battery replacement surgery? This procedure, also known as implantable pulse generator replacement, is a common part of managing Parkinson's disease. While the risk of infection is generally lower than after the initial surgery, it is still an important concern. Studies show that infection rates after battery replacement range from about 0.8% to 3%. This is notably lower than the infection risk after the first electrode implantation, which can be around 3%. In one study, infections were reported in approximately 0.8% of patients following battery replacement surgery. This contrasts with the higher rates seen after the initial implantation. However, some analyses suggest that the infection rate after battery replacement can be more than 3 times higher than after the initial procedure. This variability may depend on specific factors at different medical centers. Infections typically occur at the site where the battery is implanted in the chest or along the connector cables. The most common bacteria responsible for these infections is Staphylococcus aureus. Patients who have had prior infections related to their hardware are at a greater risk for subsequent infections during battery replacement. If a patient has experienced repeated infections, this risk can increase even further. Interestingly, the use of intraoperative antibiotics like vancomycin powder has not consistently shown a reduction in infection risk. In some cases, it may even increase the risk, which highlights the need for careful planning when it comes to infection prevention strategies. When infections do occur, treatment usually involves antibiotics. In more severe cases, surgical intervention may be necessary. This could range from cleaning the infected area to removing some or all of the hardware, depending on how serious the infection is. For those managing Parkinson's disease, understanding the risk of infection after battery replacement is crucial. Infections can lead to the need for hardware removal, interrupt therapy, and ultimately worsen patient outcomes. Therefore, it is essential for patients to be closely monitored for any signs of infection after surgery. Preventive measures should be tailored to each individual's risk factors. In summary, while the risk of infection after DBS battery replacement is relatively low, ranging from 0.8% to 3%, it remains a significant concern, especially for those with a history of infections. Careful surgical techniques, thorough perioperative care, and vigilant patient monitoring are vital to minimize this risk and ensure effective management of Parkinson's disease. Always consult with healthcare professionals for personalized advice and care.